Cold weather has a number of effects on the breathing system, which are particularly more troublesome if you have a long-term health condition. The first is that the cold, dry air dries out the lining of your lungs, which means that if you suffer with COPD or asthma, you're more likely to have a troublesome dry cough. This increases your risk of an infection. The second problem is that as well as drying out the lining of the lungs, it also dries out the mucus that your lungs produce. This means that instead of having a thin protective layer of mucus, you actually have a very sticky, thick layer of mucus, which is difficult to cough up. It can cause a blockage of some of the smaller airways, making it more difficult to breathe. And it can also result in an increased infection. The effect of these two issues is that we see an increase in presentations for primary care consultations with a GP or into secondary care, so that's at the hospital, where people have become unwell because of an infection. And the advice that follows is just some simple steps that you can take if you have a long-term lung condition to reduce the risk of becoming unwell over the winter period.
There are lots of things that you can do this winter to try and look after yourself in relation to your respiratory condition, whether that be asthma, COPD, bronchiectasis, or whatever it is that you suffer from. It's really important that you take your regular preventer medication on a regular basis and don't miss doses. If you do start to notice that you're getting a chest infection or your breathing is becoming worse, it's important to start any antibiotics or steroids you may have been provided with at the earliest opportunity. You may have been offered your flu vaccination by your GP surgery. It's really important that you take up this offer. It will help to prevent you from experiencing severe symptoms because of flu. It's important to make sure that you stay warm, that your living area is kept to approximately 21 degrees and your bedroom to 18 degrees. And also, if you are going out and about, make sure that you check the weather forecast first. And if it is going to be cold or windy or wet, either avoid going out and about or wrap up warmly. It's very important to stay active when you're unwell, otherwise you run the risk of making things worse. I think that the most important thing out of anything to do is make sure that you don't leave things too long. Seeking early advice from the appropriate person is the most sensible thing to do. The longer you leave being unwell, there is more chance of you getting worse and actually ending up in a hospital, which is exactly where you don't want to be.